Hello, welcome back to the channel, Masters of the Universe Club. And this is a book club episode. My name is Keith Fredrickson. My goal is to help you master your universe in bite-sized chunks. Every week I go chapter by chapter through a recommended book and I discuss one small thing that inspired me and will hopefully inspire you to take action in your life. If you're listening to the audio version, we are reading the book, Holistic Dental Care by Nadine Artemis. Please buy the book through my affiliate link, which will be in the show notes or description. Read along with me and master your universe. If you want to hear a more deep dive discussion, please consider joining my Patreon, which will also be linked in the description. And I'm trying to get all this good natural light from this window, but it's a little bit too much light, so I'm trying to hold the book in such a way that there's less glare. We're up to chapter 1. Which is called The Invisible Toothbrush. And I'm going to read an excerpt from the book about Dr. Ralph Steinman, who was a dentist a pioneering dentist in the late 1950s. Steinman was motivated to explore the theory that teeth might possess an internal lymph-like fluid that acted as a fortified mechanism against cavities. He delved into research and developed a technique that allowed him to visualize dentinal fluid flow by using a fluorescent dye marker in rats. By tracking the dye, Steinman documented an astounding observation that teeth are indeed internally active. Dye injected into the rat's stomach. Why they had to inject it, I don't know. They couldn't just feed the rat. I'm not sure. But nevertheless, dye injected into the rat's stomach appeared in the tooth's inner pulp chamber, which I bet you didn't know existed. Inner pulp chamber within 6 minutes, and it was visible in the enamel of the tooth within an hour. He found a constant microscopic flow of fluid in the teeth that originates near the intestinal area and flows upward and outward through the tooth. This dentinal fluid flushes toxins from the tooth, provides nutrients for the tooth's mineral matrix, and repels microbial biofilm on the tooth's surfaces, thereby preventing tooth decay and gum disease. So, before I read this book, I had no idea that was occurring. So, the fluid flows in a centrifugal outward and upward direction through the pulp of the tooth and into the enamel like sap in a tree. Ultimately, it appears on the surface of the enamel like beads of microscopic sweat. Tiny droplets coalesce on the surface of the enamel, forming a protective fluid layer. If there is a crack in the enamel, the fluid volume increases in that area, like sap responding to a wound in the tree's bark. It is a lovely, perfect process. Since teeth are living structures in a dynamic relationship with the mind and the body, they can also heal, much like bones. They can create new tissue and exist without perishing in acid and bacteria. So she's referring to the acetogenic, I hope I'm pronouncing that right, the acidogenic or acetogenic theory of cavities where dentists thought that just sugar sitting on the surface of the tooth would cause cavities. But in actuality, it's very much about what you eat and what's occurring in your blood flow and in this lymph-like system that exists within the tooth. And then, so furthermore, proving that the tooth can heal itself, and if properly supported with good habits and diet, can prevent and heal cavities itself. Okay, each episode is super short, so I want to thank you for watching. Please buy the book through my affiliate link in the description, and that will help my channel. Read along with me and master your universe. If you want to hear a more deep dive discussion, please consider joining my Patreon, which will also be linked in the description. If there's a book that changed your life, please leave it in the comments and I will put it on my list to read. And thank you again for watching. Bye-bye.